Hello, you're welcome again to the channel, The Teacher Channel. The Teacher Channel. So this channel is where you can get valuable information that will get us ready against emergency. Okay, that is what we're here. We're here for serious business. We are not here to talk about money, even though talking about money is important. We're not here to talk about fashion. We are not here to talk about the latest technology. We're not here to talk about politics. We are here to talk about what matters most, which is life. Okay? Life first. He that has life has hope. Has everything. Okay, so this is why we are here. This is why this channel exists, just to make sure that the life is preserved, to make sure that we know much about emergency, so that we know what to do when emergency shows up. Even how to recognize the emergency. Because if you can't recognize emergency, how then will you act? So the channel serves a lot of purpose. A lot. Okay, so so I'm starting a series. Okay, and it's going to be a long stretch. And it is going to include a lot of topics. So the topic before us today is just introductory. And in this presentation, I'm going to just define. So it's going to be definitions. So I'll define concepts, some of the important key concepts. And again, this definition is important. It's an appetizer. Is just setting us on the mark. Okay, so that soon we're going to take off. By the time I begin to bring some other topics, very, very interesting topics. Topics like heart attack, topics like cardiac arrest, topics like hypoglycemia, hyperglycemia, hypothermia, stroke, transient ischemic attack, allergic reaction, shock, choking, CPR, AED, seizures, asthma, poisoning, burns, spinal cord injuries, head injuries, fractures, many topics. So those topics are in the pipeline. They are ready, but I will bring them one by one. But let us start with this introductory presentation that will open the door for other topics to come. So first aid, what is it? So first aid is a basic care given to a person who is injured or sick from an emergency. Basic care. So when you talk about first aid, you're talking about basic care, emergency care, which is given to a person. That person is injured or that person is sick as a result of some emergency. So that is first aid. This is the definition of first aid. So go with that. First aid is a basic care given to a person who is injured or sick as a result of emergency. So first aid is a help given to someone who is in need due to emergency. So when you perform first aid, you are actually providing help. Why are you providing help? Because somebody is in need of help. Why is the person in need of help? That person has just been affected by some emergency. So first aid is a response. A response. Okay? A response to emergency. A response to somebody who is in emergency. Then what is emergency? An unforeseen combination of circumstances or the resulting state that calls for immediate action. An unexpected and usually dangerous situation that calls for immediate action. Okay, so that is where that definitions or those definitions are taken from. Okay, so put it in a simple term. In a very, very simple term, emergency is unplanned situation that requires immediate action. Okay, emergency will always leave a taste of bitter taste somehow. Okay, some taste that is not pleasant. Okay, unforeseen, unexpected, unplanned, uninvited. Something just happened. And that, in most cases, will leave somebody in a very, very serious situation. And immediate action should or is required in most cases. So that is emergency. Patient. A patient is an injured or a person who is a recipient of first aid. So a patient is the person who you are giving first aid to. That person could be called a victim, could be called a casualty. So patient is used in this presentation to represent that person that you are giving a helping hand to because of emergency, the recipient of first aid. That person could be an infant, that person could be a child, that person could be an adult. An infant is somebody who is under 1 year. A child is older than 1 year but has not reached puberty. Okay, an adult has reached puberty. An adult is going through puberty or has even gone through puberty. Okay, so those are the likely possible patient that first aid may be given to. First aider. A first aider is someone who provides first aid. A first aider is someone who provides basic care to an injured or a person. So the help giver, the person who volunteers to help somebody in need, somebody who is in emergency. So if any person decides to help that person in need, that person now becomes, that person is actually playing the role of a first aider. Objectives of first aid. What are the objectives of first aid? To preserve life, to prevent more injury, to prevent injury, to promote recovery. So these are 3 P's. PPP, okay? To preserve life, to prevent more injury, to promote recovery. Those are the 3 main, 3 key, 3 principal objectives of first aid. So anytime, anywhere first aid is given, Those are the objectives: to preserve life, to prevent injury or prevent more injury, to promote recovery. Good Samaritan laws. So there are laws known as Good Samaritan laws. So laws that protect the first aider from liability from first aid. So those laws protect the first aider from liabilities. Liability that can stem from first aid. They reduce the liability of those who choose to provide first aid to injured or a person. So these Good Samaritan laws protect the first aider from liability. They reduce the liability of those who choose to provide first aid to injured or a persons. Though these laws cannot prevent the first aider from being sued, but they can significantly reduce the liability. So Good Samaritan laws cannot prevent somebody from being sued, but those laws are always there to reduce or even to protect the first aider from liability. So Good Samaritan laws, what to do to be protected by these laws? So these laws are protective. Good Samaritan laws are there to protect you. Okay, so first aider is not without protection. Legally speaking, this law protects first aiders from liabilities. But what should the first aiders do to ensure that they are protected? Number one, use reasonable skills. So when you do first aid, you must use reasonable skills. Reasonable skills must be used. For instance, it is not reasonable to perform CPR on the belly. It is not reasonable. Okay? It is not reasonable for you not to call emergency number when you know that first aid alone cannot handle that situation. So you must use reasonable skills. Number two, do not go outside the scope of the first aid training. So first aid has scope, boundary, basic. Okay, you are not expected to go outside that scope if you want to enjoy the coverage of Good Samaritan law. So at this point, I want to differentiate between first aid and medical help. Okay? Medical help requires a higher advanced knowledge. When we do first aid, we are not providing medical help. Medical help actually is provided by EMS, medical team. Okay, when you call emergency, when you activate emergency number, you are actually calling some professionals. So the professionals are expected to come with medical help. But the first aid you provide, the basic care you provide, it belongs to first aid. Okay? First aid is basic. Medical help is advanced. Usually, anybody who is providing medical help is under supervision of medical doctor, directly or indirectly. Okay, so medical help is help given by somebody who is directly or indirectly under supervision of some teams of medical doctors. First aid is not like that. You're not under any supervision. Okay, so if you go outside the scope of first aid, it means you are not venturing toward medical help, which is not you may not actually have enough to provide this type of help. So make sure you provide basic care, If the emergency requires more than what you think basic care can handle, then you need to call an emergency medical team so that they can bring higher help. Okay? Ensure you obtain the permission or consent of the patient. So make sure that you obtain the permission or the consent of the person you want to help. Okay, you cannot just force yourself into somebody. That person must give you permission. So there are two types of consent: voluntary informed consent versus implied consent. Okay, voluntary consent is the consent that somebody who is conscious, an adult who is of age, who has reached an age of accountability, who is able, okay, who is able mentally, legally, the person is conscious enough to give you that permission. So it's voluntary. You cannot force yourself. You can't force your help. Okay, the person must voluntarily, agree to be helped. So implied consent is the type of consent given to somebody who is not able to give that consent because maybe the person is unconscious, or maybe because the person is a baby, for instance, a baby who has nobody around. Okay, you can actually go ahead and help such a person using implied consent. Okay. So continue. Number 4, do not abandon the patient. Okay, so don't abandon the patient. Once you start, you have to continue until you formally hand over to EMS, or maybe the patient is now okay, or maybe your life is in danger. If your life is in danger, yes, it's okay, but you cannot just abandon the patient. You can't just do that. Confidentiality, privacy of the patient must be preserved, okay? So you must try your best to protect the privacy, the confidentiality of the person. So you are not allowed to broadcast, you're not allowed to put this thing in a public domain. Okay, so it's just between you and that person. Anything that transpires must be kept secret, private, confidential. First aid, a necessity. First aid is given in response to some emergency. We have seen that definition. Emergency is bound to happen, unfortunately. Unfortunately, the society can never be emergency free. Okay? It can't, it cannot. So emergency is bound to happen. It happens, it can show up anytime, anywhere. And it can happen to any person. Nobody is immune. Nobody is immune to emergency. There's nobody who is above emergency. Emergency can happen anytime, anywhere, and to any person. Okay? All this underscore the necessity and importance of the first aid skills. So for the fact that the emergency can happen anytime, for the fact that the emergency can happen to any person and at any time, at any place, even when you don't expect, it can show up anytime, any day. For that reason, it becomes important that we get to know what to do when such emergencies happen. And the only answer to that is when we are adequately equipped with first aid skills. Very important. Many people don't understand the importance of first aid. Many people are very reluctant even to take the course. Some people don't even see the need. It is important. it is important that we get to know what to do. Proactively, we're preparing ourselves, we're getting ourselves ready in case this ugly visitor comes knocking. Okay, so we should be able to respond to that when we are adequately equipped with knowledge, with the skills. Therefore, any effort, time, energy, and money spent in preparing oneself against emergency is worthwhile. I can't say that enough, and of course, you know that is true. Any effort, whether the effort you put to reading the manual, the effort you put to watching videos like this, or effort you put, time you put, energy you put, money you put, coming to the class to learn the skills, they are all worthwhile. They are not a waste of time, they are not a waste of effort. You are just getting yourself prepared. You're just equipping yourself in case emergency shows up, you know how to respond. So first aid is a necessity. First aid is important. It is very, very important. This channel provides education aimed at equipping the audience. Somebody like you, somebody like any other person. Okay? So this is why the channel is here, to equip you, to equip any person with information and skills necessary to act when emergency shows up. This is why the channel is existing. Okay? This channel is important. This is the channel you should bookmark. This is a channel that you should always watch out for. In fact, you should subscribe, because there are topics here you cannot find any other place. Okay? So this channel provides education. Always come back to this channel, you're going to find something. There are some videos there already. So if you have not watched those videos, please go look for them. And more importantly, there are more videos that are going to come that will actually focus on some important topics. So thank you for watching. Thank you. I cannot thank you enough. Thank you for watching. Please remember to subscribe if you have not done so. And the reason is to enable you receive notification when new videos are uploaded. Okay, so once you subscribe and then new videos are uploaded, you will get alert, you get notified. So this is very important, and so I'm gonna ask you, if you have not, please subscribe. Okay, and that is an encouragement also. Also, like and share the video, please. Like it, click the like button, share it to family members, and thank you so much. I will soon be back with very, very, very important topic. You won't miss that topic. Please keep your eyes on the channel. Thank you so much, and see you soon. Bye.